Okay, Dr. Rutherford here from Vet Triage. We're continuing through Veterinary Surgery, November 2024, investigating the weekend effect in decompressive thoracolumbar hemilaminectomy for acute intervertebral disc extrusion, an observational cohort study of 460 cases from 2018 and 2023. For those who are interested in spinal disease in dogs, I have multiple videos on my channel about that, so feel free to look into that. They're from a few years ago, but same information applies. This study comes out of the United Kingdom. The objective, to investigate if weekend surgery is associated with a poor outcome in dogs with intervertebral disc extrusion, this is specifically thoracolumbar, undergoing decompressive thoracolumbar hemilaminectomy. Retrospective observational cohort study. 460 consecutive cases were reviewed. That's a pretty good number. 401 dogs had surgery on the weekdays. 59 had surgeries on the weekend. Results. The ones on the weekend had a higher preoperative proportion of non-ambulatory dogs, but there were no significant differences between the non-ambulatory and deep pain negative subgroups. The weekend dogs had a higher risk of not recovering ambulation compared to the weekday, 79.2% versus 91.6% recovery rate. And the weekend dogs had a higher risk of postoperative morbidity, 32.2% versus 17.2% compared to weekday dogs. No significant differences in other outcome measures. Conclusion is weekend surgery for these dogs might be associated with a poor outcome, specifically higher postoperative morbidity and a poor rate of recovery to ambulation. Introduction. The weekend effect refers to the poor patient outcomes associated with admission or treatment out of hours. Meta-analyses have demonstrated a trend towards the true presence of a weekend effect. Now, if they say out of hours, that's different than weekend. Weekend is Saturday and Sunday typically. Out of hours is any time the hospital is not open for regular appointments. They only have like emergency interventions. So right away, I'm kind of confused as to the definitions. The provision of acute veterinary care is different on weekday versus weekends, with often differing staffing levels, shift patterns, and availability for senior clinicians. A recent study failed to demonstrate a weekend effect in emergency general surgery in Small Animal University Teaching Hospital. A weekend effect, if present, could have implications for the allocation of staff and resources through the working week. Materials and methods. These cases were collected from 2018 to 2023. All cases had CT scans. Some had CT myelogram with iohexol. If necessary, the myelogram is performed via cisternal or lumbar puncture. So another problem with this study is the lack of MRI. CT is good. I've used it plenty of times, especially CT myelogram, but MRI is just far better diagnostic. Surgical procedures. All surgical procedures were performed at the same practice by either a board-certified specialist or a resident under direct supervision or a certificate holder performing more than 50 thoracolumbar hemilaminectomies annually. So, there's a huge variation in skill set there. And 50 surgeries annually is really not that much if you're a high volume practice. A hemilaminectomy or pediculectomy prior to decompression of the vertebral canal, same level of fenestration or prophylactic fenestration at other levels were not performed routinely. So this is a problem for those who watch this channel know that retrospective studies typically have low numbers, although the numbers here are pretty good, at least for the weekday numbers, and they can't standardize stuff. So you want to have standardization, and surgical technique and experience levels, etc. matter a lot. So there's already some problems with this paper before we even get into it. After surgery, non-steroidal anti-inflammatories and gabapentin. They used a modified Frankel score on admission. This gauges the neurologic status of the pets. Postoperative neurologic deterioration was defined as an increase in Frankel score of at least 1 postoperatively. Complications of surgery were defined as minor, meaning not requiring treatment, and major, which required treatment. Major categories were subcategorized as to whether medical or surgical treatment was required. Results. 460 dogs in this study, 87.2% on the weekday, 12.8% on the weekend. So there was a significant difference in neurologic grade at presentation between weekend and weekday. However, no difference between cohorts when analyzing the subgroup of non-ambulatory dogs. Additionally, the non-ambulatory subgroups were not different with regard to the proportion of deep negative dogs. Weekday had a median duration of hospitalization of 48 days. Postoperative neurologic deterioration, 12.7%. No deterioration, 87.3%, and 1.2% died. The 28-day all-cause mortality, 3%. Median time to follow-up, 34 days. Again, this is all for weekday. At follow-up, 8.4% did not recover ambulation. The rate of recovery of ambulation was 95.8% for grade 3 dogs, 98.5% for grade 4, 64.9% for grade 5. Postoperative morbidity was noted in 17.2%, and minor complication 2.5%, major 0.25%. Those are all weekday numbers. Weekend, median duration of hospitalization 49 hours, postoperative neurologic deterioration 5.1%, no deterioration 94.9%, 20-day all-cause mortality 3.4%, median time to follow-up 32 days. At follow-up, 20.8% did not recover ambulation. Rate of recovery for ambulation was 90% for grade 3, 88.9% grade 4, and 40% for grade 5. Postoperative morbidity was noted in 32.2%. No minor complications, and major was 1.7%. The Frankel grade 5 score on admission was associated with composite outcome. There was no association between other neurologic grades. All other exposure variables were not associated with outcome, including the surgeon, the delay, time of surgery, myelography, and fenestration. So they were taking into account all the things that I was criticizing the paper for, which is good. I wish we had higher numbers for these things, but they reached significance. So neurologic grade on presentation was the only variable to be retained in the final model as previously defined, and also because of univariable statistical significance, there was no association between weekday and weekend and the surgeon. In other words, a board-certified surgeon was not more or less likely to operate on the weekend, which would be my theory too, that you'd have the resident operating on the weekend, not the boarded person. Univariable analysis demonstrated associations between exposure to weekend surgery and the composite outcome, recovery of ambulation, and postoperative morbidity. In the multivariable model, the composite outcome was no longer associated with exposure to weekend surgery. The recovery of ambulation and the increased postoperative morbidity remained associated with weekend surgery. The weekend dogs had a higher risk of not recovering, 79% versus 91.6% with the weekday. Weekend had a higher risk of postoperative morbidity, 32.2% versus 17.2% for weekday. For recovery of ambulation, they have this scoring system. Which came down to the number 8, meaning that approximately an additional 1 in 8 dogs would not recover ambulation when exposed to weekend surgery compared to weekday. For morbidity, the same scoring system was 7, meaning that 1 in 7 dogs would experience additional morbidity when exposed to the weekend. Discussion. There was a significant association demonstrated between exposure to weekend surgery and poor patient outcomes in 2 areas: recovery of ambulation and total postoperative morbidity. Some studies suggest that delayed decompression is associated with a worse functional outcome and increased risk of ascending myelomalacia, whereas other studies have not found such an association. Indeed, more than 80% of the dogs in the study underwent surgery with a delay of less than 12 hours, and fewer than 1 in 17 dogs underwent surgery with a delay of more than 24 hours, precluding any meaningful statistical analysis. Another study who previously published data supportive of early surgery also nuanced their findings and suggested that the benefits of early surgery might be weighed against the potential risks of operating out of hours. They're saying that maybe there's benefits of operating earlier, but if you have to operate during suboptimal hours, that could worsen the care of the dog, then maybe it's not worth going to surgery early. Gastrointestinal mucosal injury is common in dogs with this disease: vomiting, diarrhea, hematochezia, melena. This could be due to stress of hospitalization, anesthesia, surgery, autonomic nervous system imbalance, and using non-steroidal anti-inflammatories. Urinary tract infection also is common, maybe due to dysfunctional micturition after surgical decompression. A previous study reported that dogs with thoracolumbar myelopathy were more likely to require follow-up imaging after plain CT when scanned after normal business hours. And again, I would say MRI is gold standard. Pre-hospital factors include human factors and patient factors prior to the patient's arrival. In humans, the weekend effect has been shown to be partially mediated by variations in weekday and weekend case mix. So they have here a chart to try and elaborate on all the factors on the hospital and clinic side, hospital side, client side, and animal side. So on one side of it, patient factors, case mix. Pre-hospital factors include human factors like client threshold to seek veterinary care, availability of primary veterinary health care, case management of the referring veterinarian, client attitudes toward referral, and then the post-hospital factors, availability of aftercare in the community, availability of aftercare from the primary veterinarian, and hospital discharge processes. And then for hospital factors, staff fatigue, hospital caseload, surgeon experience, surgeon threshold for admission and treatment, quality of data recording, and all that leads to the number of patients experiencing adverse events and the number of patients being treated. So pre-hospital human factors can be broadly summarized as behavior of the client and the referring veterinarian leading up to the specialist referral. Hospital factors are operational differences on weekdays and weekends. In human studies, the weekend has been associated with a lower process adherence and quality of discharge. A 28-day minimum follow-up was chosen in this study because historically more than 70% of dogs experiencing functional recovery by that point. And I think that that's actually very strict. I quote people usually 3 to 4 months, not 1 month, to show recovery. However, the loss to follow-up rate in this study was 9.9%, well below 20% rate generally thought to introduce significant bias. The use of owner reporting is inherently unreliable, and it's impossible to be certain about the true onset of clinical signs. Studies in human healthcare have identified associations between midweek and weekend admissions, specific times of day, peri-weekend days. These additional definitions can be useful for future research. So in conclusion, this study provides evidence that patients undergoing weekend spinal cord decompressive surgery for thoracoumbar and intervertebral disc disease may be at a greater risk for poor outcomes, and that opportunities for patient care improvement may exist. I mean, kudos for calling veterinary institutions out. We all know this. I mean, on the human side, for example, it's somewhat known that you would like to avoid going to the ER around like June or July. That's when the interns show up, and so there's far more errors when you have less experienced doctors there, and these less experienced doctors are working 24 to 48 hour shifts, maybe 3-day long shifts. I don't know. But they work very, very long hours, and so the last thing you want to do is go into an emergency hospital and your doctor hasn't slept in 2 days. So it's a real problem in the field. So for veterinarians, be cognizant of this. It's only one study, but who knows? And for pet owners, you've got to go based on trusting that the establishment that you're visiting knows what they're doing and they're going to do right by your pet. All right, guys, we'll see you in the next video. Thanks so much. Bye-bye.